Hello everybody, welcome back to the channel. Today we're going to do part 2 of the Ignore This Video at Your Peril. All of the stuff you see in the table fits inside this box. This is my main first aid kit. It is one of 4. Before I get started, the most important thing you have to have is not on this table. The most important thing you need to have is the knowledge to use what's on this table. If what's on this table is on this table and you don't know how to use it, or you use it incorrectly, the consequences can be very severe. So I recommend that you go to your local St. John's ambulance. St. John's ambulance is worldwide. They can tell you where to go to get proper first aid training. Failing that, walk into almost any fire hall, because the fire department has to go through regular first aid training, and they will tell you where to go. And you can find out when the appropriate first aid courses and the appropriate CPR courses, because I have both, are. My certifications have expired. I am going to have to go and renew my own. So I'm in the same boat as a lot of other people. The only thing is, I've been down that road several times before, so the course should be a little easier for me. So let's go over a few things here. After watching Richie's video, I started going through my box, and I found, well, I got lots of stuff, but there's also a lot of stuff I should have, I don't have. One of these being this flexible, malleable splint. Now I ordered this online. I ordered 2. I've got one in this that's going in this box, and the other one's going on the one that's sitting on the roof of my car right now, which is my car box. I'm going to dump it and go through it as well. The other thing that I did not have that I've ordered, and I now have, is I have 4 Israeli bandages, and I have more on order. Do not confuse an Israeli bandage for a wound bandage. They're totally different. A wound bandage is kind of like 4 inches of gauze, like a big big piece of this stuff stuck on. A Tensor bandage has got glue on one side. An Israeli bandage, like this, is more like a 10 by 10 piece of gauze with a Tensor bandage on it that you clip in and you tension up. The Israeli bandage comes off. You can check it easier. Once the pad from the Israeli bandage is saturated in blood, you throw it away and use a new one. I am not about to go and open up one of these bags, because why reinvent the wheel? There are so many videos on YouTube that show you how to use these. I'll leave a link in my description box. The other thing that you need to carry are these CPR kits. This one comes from North. This one is a CPR rescue breather. I don't know who makes this one. And this is a pocket ventilator. This takes up a lot of room compared to these other 2, but all 3 do the same thing. There's a one-way valve that goes in somebody's mouth. There's a piece of plastic that goes between the victim and you. So you breathe through the one-way valve, and their chest expands, and your lips never touch their face. This is very good if you have someone with a facial or a head injury. That brings me around to this. This is a 3-inch cervical collar. I believe you should have the collar. I also believe you should have the knowledge, ability, and skill to know how to put it on without doing any harm. I don't have this because I'm going to run out and use it. I have this because I will use this in concert with EMT personnel. This is there as a backup. Can I put this on by myself? Yes, I can. Would I do it? Only if I had to. Because if you get this wrong, you can do serious harm. And the object of the game is not to do serious harm. In this pile over here, we have a wrist support, an ankle support, a knee support, and a foot support. Each one of these was $1.25 Canadian when I bought them at Dollarama. So any of you watching this in Canada, go to Dollarama. I don't know what you call it in the States or in Australia, but there are like $2 shops. It's called the 2 ringgit shop here in Malaysia. You can buy all sorts of stuff like this, very, very reasonably priced. That brings me back to the top of this box. The top of this box has got 2 cabinets that open up. This one here I have full of bandages. Again, I went to my dollar store and I bought 4 or 5 packages of bandages, and I took the packages all apart and I loaded this box and that box and the other 2 first aid kits I had with stuff I bought for probably 10 Canadian dollars maximum, and I got all sorts of Band-Aids. This particular lid over here pops up, and in this lid I have more tape like this. I have more pads, I have a set of masks, I have a flashlight, and I have an additional set of batteries for that flashlight. Everything on this case is marked, so I know where everything is. I don't have to go hunting for anything. This is a pulse oximeter. I suggest you go out and buy one. They're not all that expensive. What does this do? This goes on your finger. And when you put the 2 AA batteries in it, I store mine with the batteries out. I am going to be getting not only a pulse rate, but as also I can tell, it'll tell me how much percent of oxygen is going through my blood when I use it. That information can be critical to your CPR, to your EMT people, especially if they are busy doing things like CPR. They can actually find out if the victim is still alive, all on something you carried that's this size. Very, very small. 7 rolls of tape. This is sorbeline cream. This stuff I got in Australia, and it is a godsend. One of the best creams I've ever used. If you're a diver in Australia, buy yourself a bottle about that size and put it in your dive bag. I carry mine where my regulators are. It's come in handy more than once. Gauze rolls. You're always doing gauze. If you got a hand injury, like when I broke my hand, the doctors put a 2-inch roll rather than a 1-inch in my hands like this, and then an aluminum splint with foam on the bottom went across my wrist where my watch is and around my hand and back to here, and I was like that for about 3 weeks when my hand healed up. All sorts of gauze pads. You're going to use a lot of gauze pads. What I have here came from the dollar store. This, believe it or not, is for makeup removal, but you can put a lot of these pads on and use them for collecting blood. You've got to remember, this first aid treatment is only designed to get somebody to the hospital. It's not supposed to last forever, okay? It's just to get somebody patched up, to get them to proper medical treatment where they can tear all this stuff up and throw it away. If you can control bleeding and patch things up using stuff like this, which is only $1.25 a bag, and there's 50 pieces in here, why not? These are steri strips. These are like miniature sutures, miniature stitches. You pull the skin together, you put this across, and it's supposed to hold and keep everything together. This is the back support belt that I have. My back is shot. Belt size on this is 30 to 36 inches, which means if I don't go on a diet, I can't use it anymore because I've got too fat, but that's just me. You'll find I have a lot of various sizes of gauze bags. These are the ones on the front here are 3x8. The one in the back here are 4x8. These are 3.5 by 2, 3.5 by 9. This is 8 by 10. These are 10 by 10. These are all the different types of gauze pads I have, plus the smaller sections of gauze in here, and the 4x4 gauze that I have in here. You're going to use a lot of gauze because you're packing wounds. Is this necessary in a first aid kit? Well, it's nice to have. What these are hot packs. So if you got like a sprained ankle, or your back is really sore, you get your shoulders all banged out of joint, you can put one of these hot compresses on and it'll help make things a little easier. Is it really 110% necessary? Probably not, but I carry some because I'm old and I'm all banged up. another set of masks. One of the things that you need to do is you need to go see your doctor, or at least I did, and I asked him for some syringes. And I told him, look, I'm building myself a first aid kit. Can I get some syringes? So he gave me these 4. Actually gave me 5. These 4 have never been used, and they are all together because they've never been used. They do not screw on this. I use these for removing splinters. These are really good for removing splinters. A lot better than tweezers. You're not digging in there with a knife blade. You're not trying to cut anybody open. These can come along. You can get underneath the skin very, very easily and pull the splinter out. The one that I use for me is in this bag here. Thermometers. This one is your oral thermometer. It can also be used as an anal thermometer. This is analog, shall we say. You put it under your tongue for 5 or 10 minutes, and this one is digital. The syringe. This syringe is used to draw hydrogen peroxide, which is in this bottle and in these. Hydrogen peroxide does not sting. So what I do is I draw this out of the container with my syringe, and if my syringe does not go down, I will then pour this into a cup or something that's clean. I will then pull the hydrogen peroxide up with this, and I can apply this against the edges of a wound. Hydrogen peroxide will foam up when it's killing the bacteria that are there, and it's just basically like putting water on your hand. There is no pain. If you use something like this, which I bought as a backup and is now leaking, which is isopropanol alcohol, this stings. You don't want to put this on an open wound, because whoever you're pouring it on is liable to give you a smack cross side of the head. This burns. Again, more masks. The most interesting thing you're probably going to say is, what the heck have I got meat tenderizer for? If you're stung with jellyfish, this works. Make it up as a paste and put it on there, and it works. Look it up. The other thing that I carry that I will not recommend that you use, but I use it, is this stuff. Oops. This stuff. And what this is super glue. You'll find this used in hospitals and surgeries. If you've got a wound, you can pull the wound together and get it dry enough, get a couple of drops of this, and it'll bind that skin together. And all you have to do is ask anybody who's been using this to glue something together, and they've got it on their fingers, and now they're stuck like this. How do you get your fingers off? Well, I know how, but I'm not going to tell you. You go find out on your own, because I do it a rather interesting way, and that's for me to know and for you to find out. Someplace like Princess Auto, you're able to get a little inspection mirror. Believe it or not, this is a stainless mirror for dental. And I can get hemostats. I can use this to take a cotton ball, put the cotton ball, cover the cotton ball with my hydrogen peroxide, and I can rub that across a wound, even though I much prefer using Q-tips. You'll find I have a lot of Q-tips because I use Q-tips a lot. I find I can get in with Q-tips. It's not as obtrusive. It doesn't scare the person I'm trying to work on. If you come at them with something like this, they're going to wonder, what the hell is he going to cut? And they have a tendency to panic. The other thing I have in here, come on guys. This is a stainless steel rod that I can use for pulling out rocks, twigs, little bits of this and that. Again, here's my mirror. And I have various different hemostats. Again, they can be used in conjunction with your EMT provider. You are not a medic, you are not a surgeon, you are there to try to stop the guy from bleeding to death so that he can get to hospital. EMT scissors. Right here there are 2 pair. I probably own about 8. You can cut dimes with this. I've done this. These 2 have been coated in alcohol and then wrapped up in saran wrap to keep them clean. These are made of stainless steel, and like everything else, yes, they come from China. One of the things that I carry with me if I'm out in the bush is these are cotton balls that are been coated in Vaseline. This makes great fire starter. You want to keep your hands clean, buy yourself a small set of disposable gloves. You can get these almost anywhere. This bag holds, I think, 10 or 12 pairs, whatever it is. I've had it open because I had to use one. Put these on, keep yourself clean. Again, everybody, go and get proper training. Proper training is key. All of the gear that you buy is totally useless if you don't know how to use it. I cannot stress that enough. You must learn how to use the gear you've got. And with that, bye-bye.